When it comes to breast cancer treatments, there are more options now than ever before. The main goals of these treatments are to remove as much of the cancer as possible and to prevent it from returning. It's important to educate yourself about the different options available to find the best treatment for you. Before your doctor recommends a treatment for your breast cancer, they will consider several factors, including the type of breast cancer you have, the size of your tumor, and how far the cancer has spread in your body, also known as the stage of your disease. They will also take into account whether your tumor has receptors for certain proteins, such as HER2, estrogen, and progesterone, or other specific features, as well as whether your breast cancer is associated with certain genetic mutations. Your age, menopausal status, other health conditions, and personal preferences will also be taken into consideration during the decision-making process for your treatment. Treatment for breast cancer may involve several different options, depending on the specific situation. These include surgery. This may involve removing the tumor, part of the breast, lumpectomy, or the entire breast, mastectomy. Radiation therapy. High-energy waves are used to kill cancer cells, often in combination with surgery. Chemotherapy. Medications are used to kill cancer cells, either in pill form or through an IV. Hormone therapy. Drugs are used to prevent hormones, especially estrogen, from fueling the growth of breast cancer cells. Targeted therapy. Medications are used to target specific types of breast cancer cells, such as those with high levels of a protein called HER2. Immunotherapy. This method uses the body's own immune system to target and fight cancer cells. Your treatment plan may involve a combination of these different approaches. When it comes to breast cancer treatment, there are various options available for women. It's important to have a discussion with your doctor about the risks and benefits of each treatment, and how they may impact your lifestyle. Joining a support group can also be beneficial, as other people who have experienced breast cancer can provide valuable advice and understanding. Additionally, consider asking your doctor about participating in a clinical trial, which tests new treatments before they are widely available. Breast cancer treatments can often come with side effects. Some of these side effects, such as nausea, weight changes, fatigue, and hair loss, can go away once the treatment is finished. However, there are also side effects that may appear later, such as arm swelling, changes in skin or nails, mouth sores, symptoms of menopause, difficulty getting pregnant, depression, trouble sleeping, and difficulty thinking clearly, also known as chemo brain. Narration. Around 25% of the almost 288,000 women diagnosed with breast cancer in the United States each year have not yet gone through menopause. Some chemotherapy and hormone therapy drugs used to treat breast cancer can cause infertility or early menopause. It is important for women who have not yet gone through menopause to use birth control during these treatments, as some chemotherapy drugs can lead to birth defects. Chemotherapy-induced menopause can occur in 10% to 50% of women under 40 and in 50% to 94% of women over 40. After chemotherapy, there may be months or even years of irregular ovarian function. Radiation therapy generally does not cause infertility unless it is directed at both ovaries. Depending on the type and extent of the breast cancer, a woman's ovaries may be surgically removed or radiated to decrease the amount of estrogen her body produces, resulting in permanent infertility. For women with breast cancer who wish to start or expand a family in the future, there are options to preserve fertility before beginning treatment, including freezing eggs or embryos, freezing ovarian tissue, egg donation, and hormonal suppression of the reproductive organs. The last option involves using hormones to put the reproductive organs in a dormant state and is still being researched. Breast cancer treatment can bring some side effects, but there are ways to deal with them. If you've had a mastectomy, you can use an external prosthesis that can be covered by insurance. Hair loss can happen due to chemotherapy, but there are cooling caps that may help reduce hair loss. Arm swelling, also known as lymphedema, is another side effect that can be lessened if you spot the symptoms early. Weight gain or loss may occur during treatment, and it's important to eat nutritious, balanced meals to stay healthy. Skin and nail changes are also common after treatment, but they usually go away when the treatment ends. Living with breast cancer can take a toll on your emotions. You might feel tired, frustrated, angry, or sad at different times. Sometimes, depression can also occur during the breast cancer experience, and certain treatments like chemotherapy, hormonal therapy, and pain medications can contribute to these feelings. If you're experiencing signs of depression, such as sadness, lack of energy, loss of interest in things you usually enjoy, trouble sleeping, feeling hopeless, or thoughts of suicide, it's important to talk to your doctor. They can help determine if it's depression or extreme fatigue. Your doctor may be able to adjust your medications, suggest complementary therapies like yoga or art therapy, prescribe antidepressants, or refer you to a therapist. Managing your emotions is crucial to staying on track with your breast cancer treatment. Here are some simple things you can do to help yourself feel better. Remember that your feelings can and will change. Engage in activities that bring you calm and relaxation, like taking a walk, watching your favorite TV show, or doing a puzzle. Get some moderate exercise. Eat a healthy diet and avoid refined, sugary foods and alcohol. Spend time with a friend or loved one every day. Find someone to talk to, whether it's a friend, loved one, or therapist. Be gentle with yourself and don't expect to do everything at the same pace as before. Break chores into smaller tasks and accept help from others when needed. Postpone important decisions, like changing jobs or getting married, until you feel better. When you have breast cancer, and you're receiving treatment, you may experience symptoms and side effects. Even if the main goal of your treatment is to cure the cancer, it's also important to consider palliative care, which focuses on easing discomfort and emotional distress. The type of palliative care you receive depends on a few factors, such as your specific symptoms, your overall health, the stage of your cancer, and your personal preferences. It's important to discuss palliative care with your doctor at the beginning of your treatment, as they can help you find the right type of care for your needs. Your options for palliative care may include medications, chemotherapy, or radiation to shrink tumors and manage pain, changes to your diet, mental health support, stress reduction techniques, and more. Complementary medicine is not a replacement for standard medical treatment for breast cancer, but it can be used alongside it to help with symptoms and improve quality of life. Some forms of complementary medicine include yoga, meditation, acupuncture, creative therapy, massage, and botanicals. It's important to talk to your doctor before trying any complementary therapies, as some may not be safe or could interfere with your treatment. Your doctor can help you find the right therapies that are safe and effective for you. If you're interested in trying complementary medicine, the National Cancer Institute has a list of current clinical trials for complementary therapies on its website. This program, called Look Good Feel Better, is a collaboration between the American Cancer Society, the Personal Care Products Council, and the National Cosmetology Association. It is designed to teach beauty techniques that can help enhance your appearance and boost your self-esteem during and after cancer treatment. If you want to learn more about this program, you can call 800-395-LOOK or visit their website at lookgoodfeelbetter.org.